I'm the Executive Director of Oklahoma State University Center for Health Systems Innovation. Sometimes many of the problems we have in our U.S. healthcare system really revolve around the business issues related to healthcare. So the center was created to exist between the business school and medical school and really focus on the business of healthcare. The center was created about 4 years ago. There's an alum of Oklahoma State University. His name is Neil Patterson. He donated seed money that became an endowment that funded the early start or the early seed capital to get the center funded. And he also donated the largest clinical data set available. So it's a clinical data set with clinical data for 63 million patients that's been collected over the last 18 years from across the entire United States. We decided to focus on really two areas. First is rural healthcare, and the second is health analytics. 20% of America, or 60 million people, live in rural America dealing with inadequate healthcare. It's the largest health disparity zone we have in America. And if you look at Oklahoma, Oklahoma has about 1.3 million citizens living in rural markets where the healthcare system is largely inadequate compared to what's available to many people living in urban settings. Our mission is to transform rural and Native American health, and our vision is to do that through the implementation of new care delivery models and analytic solutions. We contract with those physicians for a subset of their patients, which are the Sooner Care Choice patients, which are Medicaid patients. And what we do is we provide for those patients care and case management services. So when they go to the doctor and the doctor says, okay, you need to go get this prescription filled, you need to go see this specialist, you need to go get this therapy, we as case managers within our organization, which is a group of nurses and licensed clinical social workers, they provide case management to make sure these patients get their medications filled, get to the specialist to get the treatment, get to the post-acute care therapy that they're supposed to get. So we provide that. So we do it hand in glove with the physician's offices. We're just making sure that they get the appropriate care after they leave the primary care setting. So we took the data, for instance, in diabetic retinopathy. We had 2 million patients in our data set. We think we can predict whether or not a patient has diabetic retinopathy just based off the data collected in a primary care visit. So their demographic information, their comorbidity information, and data collected in a normal lab workup. So think about it now. So a diabetic patient is in a rural setting. The primary care doc can now say, based on the results of the data, you need to go to an ophthalmologist because based on your data, it looks like you have diabetic retinopathy. We built over 200 models, and now we think have a predictive tool that allows a rural primary care doc to manage diabetic patient complications. So a lot of the healthcare companies are really interested in what we're discovering in rural delivery to how do we improve that, because they'd like to translate that across the entire United States.